Why is it important for MDS patients to know the genetic abnormalities of their cancer?
It can help to influence prognosis or obviously tell us a lot about prognosis. Also, occasionally when we're doing this testing, we may pick up a genetic mutation that we actually do think was inherited and which may have a risk associated with it in terms of prediction for other cancers. So sometimes that mutation may need to be looked at more closely, and family members of that individual may even need to be tested.
Genetics, especially nowadays, is very important, particularly for MDS. Nowadays, by default, genetic mutations are tested. So if you get a bone marrow biopsy for MDS, in most academic centers, genetic mutations are tested. Genetic profiles are important in giving patients prognosis. So by looking at a particular set of mutations, we can make an educated guess in how long patients can live without relapse, how well they respond to chemotherapy, or how poorly they respond to chemotherapy. In addition, there are a couple of mutations that I mentioned earlier that we have targeted agents for. So if a patient happens to have one of those mutations, we can use specific set of therapy to target those mutations. It's a very important information to have to choose the right therapy, to tell the patient what to expect, even tell them in a general sense how well you'll do in the future. And in some patients, we can also risk categorize what's the risk level of having an inherited mutation. So most of the mutations are acquired. It's not inherited. It's not something that you were born with, something that you will not inherit to your children. That takes about 90% of the cases. It's a newly developing field. In about 10 to 20% of the cases, now we know that MDS might have been caused by inherited mutation, inherited gene changes, and that can be carried to your offspring. So when we think a patient is at high risk for that type of mutations, then we also screen them for possibly inherited genes as well. And those type of patients are patients who were diagnosed with either leukemia or MDS at a younger age, for example, less than around 50 years of age, or those patients who have multiple family members with various cancer, or those patients who have more than one cancer. So if you have MDS or leukemia and have another type of cancer, then we start thinking about screening them for potentially some mutations that they were born with, that they were inherited. Regardless, testing gene mutations and testing genetic profile is extremely important for MDS. There are a number of syndromes where a particular set of cancer is expected. So, and there are a number of them. An example would be something called Leukemia syndrome, which is due to mutation in a gene called TP53. In this type of a patient, you can have MDS, you can have leukemia, and you can have pancreatic cancer, you can have a very rare muscle or bone cancer. So there's a syndrome for that. And there are many examples out there, but in general, we don't always look for a specific type of a cancer because those syndromes are rather rare, and there are many things that we still don't know. So any cancer, if you have more than one, we become more suspicious and start thinking about screening them.